We will now review general outbreak detection and rapid response strategies that you may encounter while in a humanitarian field response. While these may sound organized in a lecture presentation, commonly field work is complicated by supply chain interruptions, poor communications, a lack of electricity, possible insecurity, and coordination gaps. Be prepared to be creative in how you adapt these strategies to local context. Once an outbreak has begun, the main goal is to detect it early and respond effectively. Rapid response interventions aim to avoid exponential outbreak growth, thereby limiting spread and the number of people affected. To achieve this, one needs to detect diseases of outbreak potential early and intervene rapidly with effective prevention and mitigation measures. Improving global health systems to detect early and respond is core to the international health regulations, with a central role for the World Health Organization in providing technical support. A key strategy to detect an outbreak early is surveillance. In public health, surveillance refers to activities that try to detect, count, and monitor diseases of interest. It comes in two broad forms, active and passive. Active surveillance is where the surveillance staff routinely reach out to the community or health facilities to identify cases of a disease. For example, walking a refugee camp every day to look for people with fever and rash would be a form of active surveillance. Passive surveillance, on the other hand, is where the surveillance staff wait for individuals with a disease of interest to come to them. An example of passive surveillance might be counting those with fever and a rash coming to the health clinic for care. Surveillance activities may be based in different reporting locations or a combination thereof, such as the community, health facility, or laboratory. They may be case-based, where individuals with certain symptoms are counted, or may be event-based, where reportable events, such as a cluster of deaths due to unknown cause, are reported. Pictured here are WHO epidemiologists working to implement the Early Warning, Alert, and Response Surveillance System, or EWARS. EWARS is increasingly used in emergency settings as a focused, rapidly deployable surveillance system to detect diseases of outbreak potential. Core to any surveillance effort is the case definition. The case definition describes what to report and count. Importantly, the definition is standardized for routine surveillance and may be adapted during an outbreak. A good example is cholera, where one initially aims to use a confirmed case definition through laboratory testing results to determine whether an outbreak is present. Once an outbreak is declared, cholera surveillance typically relies on a suspected or acute watery diarrhea case definition without routine laboratory confirmation. Applying a case definition successfully is often important for linking individuals to appropriate treatment services, also known as case management. Pictured here is a field team in Abuja, Nigeria, conducting active surveillance in the community during a declared cholera outbreak. The community is located directly next to a massive garbage heap, representing significant environmental challenges for improved sanitation. Now let's review some of the key steps in confirming an outbreak. First, an alert notification is made, followed by an investigation. The investigation involves case review or interviews, active case finding for additional persons sick with the disease, and specimen collection. Specimens may be blood, urine, cerebrospinal fluid, or other types depending on the disease suspected. The next step is confirmatory diagnostic testing. This may occur at or near the point of collection using rapid diagnostic tests or field deployable diagnostics. Frequently, however, specimens may be properly packaged and transported to a reference laboratory. Finally, case investigations and laboratory results will be used in analysis to determine whether the outbreak threshold has been met. The outbreak threshold is a pre-specified number of cases that must occur before an outbreak is declared. It varies depending on the pathogen and may be as few as one case or many cases for an endemic disease. This is typically included in surveillance standard operating procedures. Confirming an outbreak is important to raise awareness and mobilize a response. Rapid response teams are an important resource in accomplishing the strategies already mentioned in this section. They are deployable teams for public health emergency response. By definition, they should be prepared, ready, and able to deploy quickly. Rapid response teams are typically multidisciplinary. For example, they may include a surveillance officer to collect information from the case, a laboratory technician to collect specimens, and a communications team member to address community concerns, among other roles. Core to their function is being equipped to investigate and respond to outbreaks. Importantly, they should be supported by a coordination structure that can mobilize them effectively and synthesize information collected to guide further response action. Since all outbreaks rely on an informed population willing to engage in effective prevention practices, risk communication is an essential strategy. It involves providing clear and concise key messages to the affected population. A common mistake occurs when outbreak communication is only one direction, from responders to community. It is critical for any outbreak response to engage, hear, and address concerns raised. Communicators have the responsibility to convey key facts that will empower community members to minimize risk and remain safe from communicable disease. This includes specific information in plain language on how to stay healthy and what to do if sick. Pictured here, a member of UNICEF provides key facts using a poster to a community in West Africa during the Ebola outbreak. When you have a moment, consider some of the challenges you might face in this activity and what you would do to address them.